Alright, you guys, for this World AIDS Day project, we are going to be learning about the South African country of Mozambique. We're going to start with the geography and social demographic. Population in Mozambique is approximately 27,233,789, with majority of the population, 44%, being only 0 to 14 years old, and 2.88% of the people in this country are over the age of 65. The literacy rate here is 58.84%, where generally males have a higher literacy rate than women. The life expectancy rate here is 54.1 years. For males, 53.3, and for females, 54.9. In Mozambique, the total number of people living with HIV is 2.2 million, which we will come back to later. Mozambique is located in the southeast quadrant of Africa, bordered by Zimbabwe, Swaziland, Tanzania, Malawi, Zambia, and the Indian Ocean. It is approximately 799,380 square kilometers of beautiful tropical climate, maintains around 80 degrees Fahrenheit year-round. Next, we will move on to the government and economy here in Mozambique. Government here is a republic and multi-party democracy. This means a representative of multiple parties run for election. They elect a president every 5 years through an electoral vote. The president, similar to here in America, cannot serve more than 2 terms. The current president is Felipe Jacinto Nyusi, who was elected in 2014 and was re-elected this past year. He previously served as prime minister from 2008 to 2014. His elected prime minister is Carlos Agostinho do Rosario. Here in Mozambique, the GDP from 2018 was 14.46 billion US dollars, which ranked it 120 of the 192 countries. Currently has 12.9 million people in the labor force, which works predominantly in agriculture. Only about 4% of jobs in Mozambique are industry jobs, while 75% are in agriculture. The unemployment rate here is 24.5%, ranked 152 in the world. Here is a quote from President Nyusi addressing the members of the board on World AIDS Day in 2017. Says, "It's time for action. We need to fast-track the HIV response in a coordinated way, in partnership with all key stakeholders." During this meeting, the members ultimately agreed on the 90-90 treatment to end the AIDS epidemic. The plan is that by 2020, 90% of all people living with HIV will know their status, 90% of all people diagnosed with HIV will receive sustained antiretroviral therapy, and 90% of all people receiving antiretroviral therapy will have viral suppression. Next, we will move on to HIV prevalence in Mozambique. Previously mentioned, 2.2 million people living in Mozambique are infected with HIV. In 2018, there were 150,000 new cases found, and 54,000 people died due to HIV complications. It is the leading cause of death here in Mozambique, followed only by malaria and perinatal complications. The amount of people infected is probably more than 150,000 because people here are not tested as regularly as they should be. Only 34% of women get tested yearly, while only 17% of men. This allows for the unknowing spread of this disease. Next, we're going to talk about antiretroviral therapy. 1,202,562 people in Mozambique received antiretroviral therapy in 2018. 67% of all infected adults over the age of 15 are receiving this antiretroviral therapy, and 62% of infected children under the age of 14 are also receiving this therapy. The average cost to supply ART, short for antiretroviral therapy, and ARV, which is antiretroviral drugs, is about $117 per person per year. 44% of people who are aware of their HIV status are being treated with therapy. That's less than half of the estimated infected population, and even though there are over 200 clinics in Mozambique where it is offered, only 50% of the population has access to this health care, because nearly 30% of the population lives more than 30 minutes away from the nearest healthcare facility. People most affected by HIV. 58% of those infected by HIV in Mozambique are women, and they can spread the disease sexually, but also to their unborn children, hence, pregnant women being the second on this list. 25 to 48% of pregnant women who are infected with HIV will spread it to their baby. Sex workers are also at risk of getting HIV due to high amounts of unsafe sexual activity. In 2018, there were 39,000 cases of sex work-related infections. Also have prisoners. South Africa has the highest rates of HIV in prisons, as nearly 30% of the prison population is infected. This is due to mainly overcrowding, but also having limited healthcare access in these facilities. In Mozambique, there is a high tuberculosis infection rate. This country has the highest co-infection rate, which means that people diagnosed with tuberculosis are often diagnosed with HIV as well. 59% of all tuberculosis patients also tested HIV positive. Last but not least, we're going to talk about the education and prevention of HIV. Here in Mozambique, there are many educational and preventative actions being taken because it is one of the most highly infected countries in the world. Abstinence-only programs are most often taught because it was the most popular youth HIV prevention strategy during George Bush's presidency. They sent the program to what we call focus countries, which were highly infected areas that were already getting HIV funding from America. They implemented this program to many countries in South Africa, and the teaching stuck. The USA alone funded over $1 billion over a 5-year span to teach abstinence, and later adopted smart condom use. The CDC has set up over 100 mobile sites in the country where people who do not have regular healthcare options can get tested and treatment of HIV. The Institute of Health provides testing and conducts HIV-related research here. PrEP stands for pre-exposure prophylaxis, and it is aimed to help those who are not quite infected yet. It's providing antiretroviral therapy and drugs for HIV-negative people in order to prevent the spread of this disease. A person has a lower chance of becoming infected once exposed to HIV after PrEP. Syringe programs are an up-and-coming preventative action where clean needles are provided to users and they are safely disposed of as well. With this program, they also teach the importance of safe needle using as well as opioid addiction counseling for those who are struggling with it. Prevention of mother-child transmission is very important in Mozambique, because as we learned, up to 48% of HIV-positive mothers will pass it on to their babies. With this preventative program, mothers who are HIV positive are put on ART while pregnant in order to reduce the chance of the baby developing it. With this preventative action, the number of HIV-infected infants dropped from 170,000 to only 84,000 from 2010 to 2018. The National Program to Combat AIDS handed out 20 million condoms in 2003. More recently, programs such as GIDO have followed their footsteps and now distribute condoms as well as sell them very cheap so they are affordable for everybody. ASOSTI, which is the Informal Sector Workers Association of Mozambique, has set up educational stands and programs held at local markets so they can easily access the public. They've distributed 45,000 condoms to market dwellers between the years 2009 and 2011. Overall, there are many preventative efforts implemented in Mozambique as they want to reduce the amount of HIV-infected people. Alright, you guys, that concludes this project on HIV in Mozambique. World AIDS Day is December 1st, 2019, and I look forward to hearing the progress that this country has made. Did you know that more than 40% of HIV-infected mothers will infect their unborn child? 66% of babies born in Mozambique in 2018 tested positive for HIV within the first 8 weeks of life. You can make it stop. 95% of pregnant women receive antiretroviral drugs, which have prevented 18,000 new infections among infants. If you are pregnant and HIV positive, please access a local healthcare clinic and get antiretroviral therapy. If you are pregnant and do not know your HIV status, get tested immediately to prevent the spread of this disease. CDC has hundreds of mobile sites where you can get tested for cheap, and they will help you if you are positive, provide you with the treatment. Be part of that 95% of women.